Okay, so associated with our thoracic and abdominal pelvic cavities are a couple sets or three membranes. Okay, well, a membrane can be defined as a thin, pliable tissue that covers, so it's on the outside of, it lines, it's on the inside of, it partitions, which is kind of a fancy word for like separates or connects structures. And it's just kind of just holding things apart, kind of enclosing them on the inside of them, that kind of stuff. Okay. There's a thin, slippery, double-layered serous membrane that covers the viscera, which we learned the other day. The word viscera refers to the organs of the thoracic and abdominal pelvic cavity. So, like the organs in your chest and your belly. Okay, it's a double-layered membrane, so that means that there are two layers. One of the layers lines the wall of or the walls of the thorax and the abdomen, and then the other layer is going to cover the organs. Okay. Those two layers are a parietal and a visceral layer. Okay. The parietal layer is a thin epithelium that lines the wall of the cavities. The visceral layer is a thin epithelium that covers and adheres to the viscera, covers the organs within the cavities. The parietal layer is superficial. The visceral layer is deep, which we introduced those terms on Tuesday. Superficial, once again, means closer to the surface. Deep means deeper inside. Okay. And then in between them is a space, what we call a cavity, serous cavity, where there's a special type of fluid. It's a lubricating fluid called serous fluid. It's not a whole lot, but it is enough to reduce friction so that the two membranes, as you know, motion occurs as the organs kind of expand and contract and that kind of stuff, they are having a lot of friction, like wearing holes in each other. Okay. Think of the relationship between the organ and the two membranes in the space, kind of like what would happen if you pushed in on an inflated balloon with your fist, like shown here. The fist represents the organ, whether it's the heart, whether it's the lungs, whatever. Okay, the part of the balloon that's actually directly touching the fist would be the visceral layer. Okay, and then there's the space or cavity, and then on the outside, the other layer is the parietal layer. Okay. Now, we're going to introduce these three membranes today, but I honestly won't talk about them again until quite a bit later in the semester, almost at the very end. Unit 6, we'll talk about the pericardium. Unit 7, we'll talk about the pleura. And then also Unit 7, we'll talk about the peritoneum. So that's way down the line. Okay. We introduced the terms pleura and cardia the other day. Pleura or pleural always refers to lungs, and the pleural membrane or pleura is the serous membrane of our pleural cavities. The pleural cavities, remember, are the ones associated with our lungs. There are two layers to each of these three structures. Okay, each of these three membranes has two layers. The visceral pleura clings to the surface of the lungs. Parietal pleura lines the chest wall. And then the space between them is the pleural cavity, and that would be home to what we call pleural fluid. Okay. Pericardium, cardiac, cardiole always refers to heart. So the pericardium is going to be associated with the pericardial cavity, and it includes a visceral pericardium that covers the heart, a parietal pericardium that lines the chest wall. And then between them is the cavity called the pericardial cavity, which is full of pericardial fluid. Okay. And then in your abdomen, which, by the way, and I don't know if I mentioned this today, but try to, and I encourage you guys to avoid just calling, this general area your stomach. In this class, your stomach refers to an organ that's in that area. Okay. Well, you could be saying my stomach, but truly be referring to something like, more like your intestines or your liver. So the stomach is not a good kind of anatomical term for just that general area. Okay. So I'll call it the abdomen, or sometimes I just call it the belly, which is obviously not a good term anatomically, but that's okay. Peritoneum is the serous membrane of the abdominal cavity, includes a visceral peritoneum, which covers the abdominal cavity, and the parietal peritoneum that lines the abdominal wall. Okay. The cavity called the peritoneal cavity is the space between those two membranes where we find most abdominal organs, but not all organs. Some organs are actually located behind the parietal peritoneum, and they are between that parietal peritoneum and the posterior abdominal wall. So in other words, like the back wall in your abdomen. And those organs, a good example would be like your kidneys. They're really far back there. Like if you were to open up the abdomen, like you see here with the skin removed, can't even see the kidneys. You'd have to remove basically all these intestines. What you'd find is a really shiny membrane on that back wall. If you got these out of the way, that shiny membrane is the parietal peritoneum, and you'd find that if you like cut that out, then you'd be able to find the kidneys. You'd be able to kind of see through it because it's kind of a see-through membrane. But that parietal peritoneum covers the kidneys, and there's some others as well. But any of those organs will be classified as being retroperitoneal. Retro meaning like being behind the peritoneum. As far as these two pictures go, this one kind of shows pleura of the pericardium. Not really actually concerned whatsoever with these two pictures. So I'll just move on to our last slide. Okay, our last slide is going to detail kind of a couple of different ways to help subdivide that abdominal pelvic area of your body, your kind of torso, pretty big area, and that abdomen from like the nipples basically down to the groin. That's a very large area. Okay, so it's very helpful, especially in like clinical settings, doctors, nurses, anatomists as well, obviously people involved with anatomy, use two different methods to divide the abdominal pelvic cavity into smaller areas. The first is what we call the abdominal pelvic region method, which creates essentially a tic-tac-toe grid across the abdomen. So you end up with 9 distinctive what we call regions. Okay. It involves 2 horizontal and 2 vertical lines. The top horizontal line is called the subcostal line. I'm not really worried about you knowing that, but it's at the bottom of the rib cage. The transtubercular line runs at the top of the hip. And then you have 2 vertical, what we call mid-clavicular lines, which run basically right down the middle of the clavicles, your collarbones. Okay. And that creates these 9 distinctive regions. Fancy and wonderful thing about it is you don't have to learn 9 different names. And that's because if you look here on this side, we have the right hypochondriac, right lumbar, right inguinal, or iliac region. Well, if we go across the body, there's not different names. Truly, I mean, you just have to replace right with left. Okay. And like I was talking about the other day, this is their right, this is their left, even though this is the left side of the image, this is the right side of the image. You got to make sure you know this is their right arm, this is their right side of their body, so this is their right hypochondriac, etc., etc. Okay. Now, I do expect you to be able to identify those 9 regions. I don't really care about the name of the lines or anything like that. So you should be able to do it here. This is going to give you that internal view of it, so you can kind of see where some of those organs are. If I choose to put one of these pictures on the exam, I wouldn't put them both. It'd be one or the other. So if you can label them here, you should be able to identify them here. Okay. It might not be a bad idea down here where, you've got the inguinals. It doesn't have in parentheses iliac. So you might write that in there. And then same thing down here. It's got pubic, but it doesn't have hypogastric. I do expect you to be able to identify those 3 regions with their 2 different names. And then on the bottom right is an illustration showing you how you can divide the abdomen into quadrants. Probably more commonly used and a lot simpler. There's just 4 different regions, or quadrants, I guess is how you describe it, since these are regions. But it involves a vertical line and a horizontal line. They intersect right where the belly button would be. And that creates right upper, right lower, left lower quadrants. So hopefully nothing too crazy there as far as naming goes. Remembering, right and upper, left upper, right lower, left lower. Hopefully it isn't too hard. I always tell this example, but it's fairly common complaint when somebody comes into the emergency room would be pain in their right lower quadrant. If a patient is experiencing right lower quadrant pain, it's very common that they're experiencing what? Anybody know? Appendicitis. And if you notice right there, this thing that looks like a little tail, that's the appendix. So that's kind of a illustration of how important it is for using this as a clinical method. Okay, any questions on anything here?